Hello, I'll be talking about Parkinson's disease. Parkinson's disease is also called Parkinson's or PD. It is a chronic progressive disease in the central nervous system. In the midbrain region, we will see the basal ganglia, and the bottom portion is the substantia nigra. The substantia nigra is responsible for the body's movement and coordination regulation. What happens to the brain of the patient or person with PD is that there is a degeneration of the substantia nigra, which results to the dying of the nerve cells of the area and drop of dopamine. PD is the second most age-related neurodegenerative disease after Alzheimer's. In this chart at the bottom, it shows us that the age onset of PD is between the age of 50 to 60 years, and more than 2% of the population older than 65 are affected by the disease. Estimated 4% of people with PD are diagnosed before the age of 50. Men have 1.5% increased risk of developing PD than women. There is no definitive test to distinguish or to diagnose the disease, including brain scans, MRI, or even blood tests. Although the medical doctors use clinical diagnosis that is based off of the patient's history and medical examination, includes handwriting samples, speech analysis, interview questions that are focusing on the symptoms or how the symptoms are developed, and physical examination. The clinical diagnosis can be made if two out of those four clinical features are present in a person. So we will talk about the clinical features or the cardinal features later on. PD impacts people in different ways. Not everyone who has PD will experience all the symptoms of PD. The medical doctors use the Hoehn and Yahr classification scale to distinguish or to determine the progression of the disease. This clip will show us how to determine or how the stages are different from each other. Stage 1 is still considered an early PD. Symptoms of PD are mild and only seen on one side of the body, which is also called unilateral involvement. So this person has a tremor on his right side. They also assess his balance or his walking. He actually has a very good balance and he can also walk independently. For stage 2, symptoms of PD are noticeable in both sides of the body, which is also called bilateral involvement. And this person has tremors on both sides. They also assess his walking, and it would show exactly like how stage 1 is. So he has a very good balance and he can also walk independently, meaning for people in stage 1 and stage 2, they can live independently. Stage 3, this is where symptoms of PD are distinguished by loss of balance and slowness of movement. This patient or this person has very small movement and some rigidity in his upper extremities, and his slowness of movement will be seen when he walks. So initially, he can rise up by himself and he also can walk independently. But as soon as he turns, he would grab onto the chair to compensate his loss of balance and his shuffling gait or shuffling steps. And then he would be able to walk again, just normally. So for stage 4, symptoms of PD are severely disabling and they would require assistive device, including wheelchair, walkers, and canes. For instance, this person here requires a wheelchair, and I would assume that she won't be able to tolerate walking for long distances. She also requires assistance to rise up from the chair, although she can walk independently. But for the people who are in stage 3, 4, and 5, they would require assistance at home. For stage 5, this is the most debilitating stage. So this person shows us that She has a very poor balance and flex trunk posture, and she would require assistance to get up and even in any activities that he would do. PD is idiopathic, meaning there is no known cause of it, but most researchers would agree that both genetics and environmental factors cause it. Environmental factors include pesticide, herbicide exposure, and drug induced. With early detection and determining proper course of action, most people with PD can still live enjoyable and fulfilling lives. The four cardinal features of PD goes by the acronym TRAP: T as in tremor, R rigidity, A for akinesia, and P for postural instability. Tremor is the involuntary shakiness that is present at rest, and a person or people with PD has pill rolling tremor. So it will look like this. It looks like they're rolling a pill in between their finger pads. Next is rigidity. This is described as stiffness or heaviness of the joint or muscles. There are two types of rigidity, which are cogwheel rigidity and lead pipe rigidity. For them to be able to distinguish, a medical therapist or a therapist would be doing a range of motion assessment on a patient. For cogwheel rigidity, there will be an off and on or an intermittent resistance in the joint. On the other hand, the lead pipe rigidity is described as a sustained um, resistance of the joint. Akinesia is the absence of movement, but it is most noticeable in the later stage of the disease. Bradykinesia is what is most noticeable in the early stages, and it is described as slow movement. Postural instability has something to do with the person's posture, walking, and balance. So, a person with PD would present as stoop posture, small shuffling steps, and freezing episodes. Freezing episodes meaning they would get stuck on one position before they would be able to move again slowly. Other clinical presentation includes dementia, slowing of thought and information processing. Also, they can suffer from depression. For speech and voice, they would have decreased voice volume, monotone speech, distorted articulation, and uncontrolled speech rate. They can also have impairment in swallowing. People with PD can also suffer from paresthesias, meaning burning and prickling sensation and pain, and this is due to the rigidity of the muscles or joints. They can also suffer from akathisia, which is the motor restlessness and agitation, meaning they would want it to move even though they're having difficulty moving. They will also have freezing episodes, as what was described earlier, and hypomimia, masked face, and this is due to the rigidity of the facial muscles. It will look like they're trying to smile, and it will look like they're still frowning. Hypokinesia is poverty or small movement, and it can result to microphagia or abnormally small cramped handwriting. The medical management includes pharmacological management, and for the early stage of PD, they would take monoamine oxidase inhibitors or MOA and symptomatic drugs, which are levodopa, dopamine agonists, and anticholinergic agents. So the symptomatic drugs will help delay the progression of the symptoms, and it will also help manage the symptoms. For nutritional management, people with PD are recommended to have well-balanced diet. The surgical management is another option if pharmacological management won't work on a person. And of course, physical, occupational, and speech therapy would work for people with PD. Other treatments considers lifestyle modification, which are the strategies of energy conservation and exercises, and community resources, which are support groups, community training programs, and day programs. Modifications include healthy eating, flexibility and strengthening exercises, encouraging them to speak better and speak loudly, showing them some strategies to avoid falls include making a U-turn instead of pivoting over their feet, keeping valuables within arm's reach, and avoiding tripping hazards. Also, use of assistive device if necessary, such as wheelchairs, walkers, or canes. Other modifications include having them make big movements, Utilize adaptive and supportive devices that can ease activities of daily living, including wearing loose fitting clothing and Velcro postures. And also teaching them some techniques on energy conservation, including spreading activities throughout the day, and having to take rest breaks in between activities. Encouraging them to plan ahead or plan throughout the day would also help them conserve their energy. Other reference that I would recommend is the Parkinson's Foundation. They are very informative. They actually gives you some information about PD, what the causes, any information about it, and the Hawaii Parkinson's Association also does that as well, and the Parkinson's Disease.net. Yeah, that's it for today.